Thank you, Jeff, and thank you, Leela. I was remiss, Leela, when I introduced you in not acknowledging part of your legacy at our community foundation as I lose my earpiece here, which is, it's better than losing my hairpiece, but might be embarrassing. In that our foundation did something that was unprecedented in the history of foundations in this country when they identified poverty as the overarching issue in this community and a point of great economic stress, and committed over the long term to tackling that in a way that I think has really distinguished our work and I think built on the partnerships that we'll be celebrating here today. So thank you for that. You did that in partnership with my predecessor, Carolyn Milne. And while Carolyn couldn't be here tonight, the legacy fund that was established by the board on her retirement is one of the key sources of financial support that allows us to do the Vital Signs Report. So it's important for us to acknowledge the 14 years of great leadership she provided to the foundation and the fact that that has continued to endure as a source of support for the good work that we get to do here. So with that, let me invite our four panelists. Steve Buist from the Hamilton Spectator, Dr. Ninh Tran from the City of Hamilton Public Health, Ian Borsuk from Environment Hamilton, and Samantha Jackson from McMaster University to join us, and I will more fully introduce them and their bios, and then we'll start tossing a couple of softball questions to them, and then we'll open it up to the more aggressive questioning that I fully anticipate will come from the audience. Also good to recognize in the audience tonight a couple of our key partners. Tom Cooper from the Roundtable on Poverty Reduction, Manny Figueredo, our Public Board of Education Director and a strong partner in our advocates work, Denise Christofferson, you got a shout out for the YWCA in your Accelerator Report, which Samantha will talk about, and Brad Park, our relatively new CEO of the Amalgamated United Ways of Hamilton and Halton. Thanks for all of you for being here and for the partnerships that you provide on an ongoing basis. And now let me try not to screw up any of your bios. Let me start with Ian Borsuk from Environment Hamilton. He's the Climate Campaign Coordinator at Environment Hamilton. He's originally from Toronto, where he worked with organizations such as the Toronto Environmental Alliance and the now successful No Jets Toronto campaign. When not working on climate change issues in Hamilton directly, he can be found wearing various hats on other issues to do with environmental, economic, and social justice. Ian, welcome to the panel here tonight. Dr. Ninh Tran is a public health physician with training in family medicine, and he has an MSc in health research methodology and a fellowship in community medicine from McMaster University. He is one of Hamilton's associate medical officers of health with responsibilities covering chronic disease, prevention, substance misuse and injury prevention, oral health, child health, sexual health, and infectious diseases. He's also an assistant professor at McMaster University. Welcome, Ninh. Samantha Jackson is a PhD candidate and a Vanier Scholar studying political science at McMaster University. She tells me she spends more time at Mills Library than I ever did, and that's probably accurate. She's a co-author of the YWCA's Hamilton Accelerator Report, the first report of its kind to analyze the representation of women and racialized persons in Hamilton's senior leadership. And last but not least, the understated and always charismatic buddy of mine, Steve Buist. He is one of Canada's most decorated investigative reporters and feature writers. Of course, he changed the conversation in this community when, over the course of virtually a decade or more now, he led all of the work on the award-winning Code Red series. He, in the last 6 weeks or so, won a National Newspaper Award for his series on head injuries by retired CFL football players. I was one of the control group on that, and he tells me that I performed, in some cases, worse than the guys who had suffered multiple head traumas.
We could only confirm that you did have a brain.
That's right. Indeed. It's good to have friends on the panel. And most recently, he did a great piece of work on the census data that really preceded our Vital Signs Report. So with all of that, let me ask you to welcome our panel, and I'm going to open the questioning. So Samantha, I'm going to single you out because Your report, I think, first of all, was new and added a dimension, thinking about our institutions and how they reflect the cross-section of both genders and races in this community, and how significantly underrepresented women and minorities are in leadership positions and governance positions. Talk to us, first of all, a little bit about the methodology of the report, and then about the findings.
Sure thing. So the Accelerator Report, as we were talking about before, is the first report of its kind to look at the representation of women and racialized groups across actually 10 sectors here in Hamilton. The methodology is important because it gives validity to what we're talking about, and it's also something that's been done previously in Toronto, in Montreal, also in London and Vancouver, so we want to reuse the methodology to have some comparators against other cities. The first thing we had to do was look at what sectors we're going to look at. With 10 sectors, we tried to get the whole range of the type of work that people do in Hamilton. Not perfect, but everything from corporate to public to the youth sector to voluntary and sort of everything in between. From there, we had to determine what we meant by a top organization in those sectors. That had to be specific and appropriate for our study. So for example, the corporate sector, we looked at corporations with top earnings. Voluntary sector, those with the most charitable donations. And then from there, we had to determine what we meant by senior leadership, because we are just looking at senior leadership. There's lots of different types of senior leadership, but we want to just look at this particular form. So we had to define it per sector. For example, the elected sector, it's pretty obvious what we mean by senior leadership. If you're elected, you're a senior leader. Somewhere like the corporate sector, we had to define it very precisely. We looked at people on boards and people on executive teams. From there, then the actual analysis started, and we had two fantastic coders, Habiba Khalid and Martine Gazuli, and they worked to pull all the names and photos of people who were in these positions that we just defined from publicly available sources. Things like websites of organizations, stuff like LinkedIn, that kind of thing. And from there, Habiba or Martine would look at this information they pulled and code each and every single person, over 1,000 for Hamilton, and determine their gender and if they were part of a racialized group. If they disagreed on that coding, a third person would break the tie, myself or my mentor and co-author, Karen Bird of McMaster. And from there, we tallied up all the information and we reported the percentage of women and racialized groups as leaders in each of these sectors. So really, really replicable stuff that we've seen elsewhere. And I just want to point out that certainly this idea of looking at a photo, or in the case of gender only, a name, and determining what someone's identity is, that's problematic, absolutely. This type of snap decision making of what someone's identity is just by what we see is problematic, but that's actually what we see every day in our everyday life, right? Someone walking through the door of a job interview, those types of analyses, those ascriptions of identity are made right away. And we actually wanted to replicate that exact process, which is why we use this methodology.
So probably a self-evident question, but why does better diversity in leadership matter to breaking down barriers across our society?
That is an excellent question. Why diversity matters, 100%. Do you have an hour? Can I take all this?
We'll give you 4.5 minutes.
Okay, I'll be shorter than that, I promise. So we know from a ton of research that diversity in leadership matters for organizations. There's decades, literal decades of research in Canada, around the world, that shows why diverse teams make better decisions. And diversity is not just women, it's not just racialized groups, it's not the intersection of that exclusively, it's also Indigenous persons, people with disabilities, members of the LGBTQ community. When we have different voices on decision-making teams, we simply make better decisions. So it's good for organizations, but it's good for the entire community, for all of Hamilton. Because when we have those different lived experiences actually making those decisions, we get better policy, we get better processes, we get better products. So for example, the elected sector. If you have women and people from racialized groups and their lived experiences making political decisions, the policy you make is going to feed and support the specific needs of people from those groups, things that are often blind spots when we're making policy generally. Same thing for corporations. If you have people from different lived experiences making those decisions around what products get made, how accessible they are, how they're actually supporting the needs of communities, you're going to be able to make things that actually fill what what people need and support the demands of the community. So in so many ways, it ripples out to better support the people who are living in Hamilton when those who are making decisions at the top actually look like the people of Hamilton.
Yeah, and
Yes, diversity.
great answer. And there is some irony, because I'm a bit of a junkie of political history, that this was the community that produced the country's first African-Canadian member of parliament and cabinet minister, the great Link Alexander, who I had the good fortune to know well growing up, and Ellen Fairclough, the country's first female cabinet minister. And yet, on that front, elected leadership and representation, we have fallen woefully behind. But I digress. We'll come back to that, I'm sure, because there's some candidates in the room, and I would be surprised if they didn't have a question on that front. Ian Borsuk, we heard a lot about the good news of air quality improvements.
Yes.
And oftentimes that relates to what's happening with industry and regulation and bigger picture stuff. But let me start with one of the negative elements of the report, which is a fairly substantial decline in the redirection of waste to recycling. And it seems problematic, and that's where all of us as citizens are either making a difference or not. So just talk to us a little bit about what's happening there and perhaps what we should be thinking about when we think about the individual contributions we can make to a more sustainable future.
So first, to start off with, the City of Hamilton does have a 65% diversion rate goal. Just to begin with, I apologize to any city staff that may be watching or anything like that, but that goal isn't attached to any time frame. So the 65% was a floating number that we had, and we were getting very close, around 50%. But that has fallen, and it's fallen pretty drastically, I think. A lot of people, when the staff report came forward that confirmed what our diversion rate was, at Environment Hamilton, we heard a lot of people who were really upset in that when someone is recycling properly, putting things in the green bin, they believe that they're doing their part. But what we've seen is in changes in how recycling and diversion happens, both in Hamilton but everywhere. We're seeing products that weren't on the market 10 years ago or 5 years ago that are now causing problems for our recycling system. We're seeing new products happen that can't be recycled, be it the black plastic that we're now seeing as takeout containers more primarily, where the infrared scanners that we use to sort our waste simply can't read them, and our entire system is bungled by these items. But also at the same time, we have to keep in mind that we send much of our recycling to China. And now that China has been recycling our waste for so long, they're starting to put in new standards of what they want to receive. So when it comes to corrupted recycling, they're making more stringent demands of what we give them. And they're saying we can't recycle all this because it's ending up in the landfill. So a lot of what we think ends up being recycled properly has been ending up in landfills. So that's where we see some upset, where people have been putting their coffee container lids in the recycling bin. That's what we were told to do for years. Now we're learning, no, you have to put your coffee lid in the garbage because it's not going to end. It's going to end up in a landfill no matter what. And this is a reality of both what's being produced and given to us as consumers, what we're choosing to purchase as consumers, but also what the city is doing in terms of communicating what we can and cannot do. But more ideally, I see a great amount of opportunity in Hamilton where we can follow the lead of other municipalities and other regions, where the City of Vancouver just last week passed their Zero Waste Act, where by June 1st, 2019, next year, they're going to start banning single-use plastic items such as straws, coffee lids, black plastic, and they're going to provide the appropriate supports to businesses to make that happen. And this is something that Hamilton can certainly do as well, where as consumers and citizens of Hamilton, we can certainly contribute, but this has to work in tandem with both the companies that are producing these things, but also the city as well.
Terrific, thank you. Tran, Dr. Tran. So in public health,
Yes.
high point, teen pregnancy, dramatic drop over the last decade. And I want you to touch on why perhaps that progress has been made. On the other hand, obesity, both by children in particular, but by all age groups, continues to be a challenge when we measure against comparators. Can you talk to us about both of those issues, both what we're doing well and what we need to do differently?
Sure. I mean, I think the good news, and it was a pleasant surprise to me, looking over the data over the last year, is that the rate of teen pregnancy has significantly declined over the last 10 years, almost cut in half. And that's more than just a phenomenon that's happening in Hamilton. We're certainly supporting the things that are going around nationally, but also so we're seeing that the trend in Ontario, it's happening in Canada, in the United States, in many developed countries. And I think we're living in a society where we're more progressive and open to talking about sex and contraception. So it used to be much more of a taboo, and I think now some of the reasons why the rates have improved is that we're much more open to talking about it. It's more of an accepted conversation, having discussions with your peers, thinking, and then even having those conversations with parents. So that's one of the things we're doing well as a society. But as we've kind of seen as part of this vital signs report, is that the picture and the average doesn't always show the full picture. So we do know that in certain neighborhoods in Hamilton, that number is still significant. It's still going down, but it is significantly higher in at least 5 different postal codes. So it is something that we are paying attention to. We're doing some more focused work to ensure that whether that be increased access to contraception, but we also know that other social determinants of things such as education, income, opportunities, especially for women, can continue to drive that trend downward. So that's the positive aspect, but also the work that we still need to do in certain areas. The obesity and overweight portion it does sadden me, because it is one of those things where it continues to worsen, again, not only in Hamilton, but elsewhere. And the numbers that is shown in the report, it's self-reported. So generally people, what you see is probably actually worse, because people tend to, on surveys, say, hey, I weigh a little less, I'm a little taller, I do a bit more physical activity, I'm better looking, all that sort of stuff, right? So we know that the trends are worsening, and I think this could be, if the trends continue, this may be one of the few times where the next generation doesn't live as long as the current generation, if the trends continue. So that's a big deal, and we're not talking about only just length of life, but also the quality of life. And we know that things like overweight, obesity, lack of physical activity impact things such as cancer, cardiovascular disease, which are the 2 top killers, but they also lead to things such as diabetes, arthritis, and diabetes can affect your nerves, your vision, that can drastically worsen someone's quality of life. So it is a sobering statistics to see, and people tend, we all, progress through our lives with certain behaviors, certain routines. So we don't start building that in terms of our children and our youth. It's going to be even harder to do that as we get older. So it is something that needs to be taken care of.
Thank you. Steve, your series All About Us. First of all of the economic indicators at a high level on average that Jeff talked about and that you captured there is real economic momentum here. Unemployment rate, building permits, all that good stuff. The really troubling part, particularly for those of us who are worried about inclusion and the sharing of prosperity, is that some of the trends that you first identified in Code Red around poverty by postal code and frankly discrepancy and segregation by race and income in some areas are in fact getting worse. So at a high level, I want you to take that on, and because you have written about this and studied it for such a length of time, talk to me a little bit about the long-term trends of the segregation of neighborhoods in this community, which continues to be a huge challenge.
Yeah, and I hate to be the fourth person here and sound like Captain Bringdown here, but as Jeff alluded to, I think a little bit, when you look at Hamilton on average, it doesn't look too bad. The problem is that hides a lot of the disparities, and really that's the issue in Hamilton, is that we have these great disparities from top to bottom. And so I'll give you some quick examples. So something like income. So if you look at household income, you see that we have a 6.5 times difference between the top and the bottom. That's huge. When you look at Burlington, it's 2.2 times difference. So, and when you look at what that bottom neighborhood is, median household income is like $20,000. I mean, that's shameful, frankly, in this day and age. But what's more alarming is that if you go 10 years back, you see that, Hamilton on the whole, its income goes up by 25%. Sounds good. That neighborhood that I talked about at 20,000, it's only gone up 10 or 12%. So what you're seeing is that the gap keeps getting bigger and bigger between the haves and the have-nots, and that's the part that should concern us. The other thing that the Census Project showed me that was hugely alarming is the gaps between men and women when it comes to income. So, for instance, women on average earn about 72% of what men earn, right? That's actually up from 60% 10 years ago, which is frankly shocking on its own. But when you look at it on a neighborhood level, what you find is that the places in Hamilton where women and men are the closest in parity when it comes to wages are also the poorest places in the city. So what you're finding is that in those places, it's probably because everyone is at such a low level of wages to begin with that there's no discrimination between men and women because you're already at the bottom of the totem pole. And it's the places around the outside, the richer places, the suburbs of the city, where the disparity between men and women is the greatest. But that could be because in those places, people have more choices about what they do. Jeff alluded to voting and voter turnout. So, as he said, there were three wards that had voter turnouts of less than 30% in the last municipal election. Well, those three wards are the three wards that have the lowest income, so they're the poorest places in the city. So those places have a double whammy. So they have, because they're poor, they don't have any real economic power, but because they have such poor turnouts, they don't really have a lot of political power either. And again, if you look at some of these wards and you break them down into little components, I mean, we had some parts of these wards where like 17% voter turnout. I mean, flip that around. That's 83% of the people aren't bothering or choose not to vote, right? The other issues that we've talked about, things like leadership and diversity. So, I mean, the other thing is that this community is very visibly different. And I know that's an uncomfortable discussion for a lot of people to have, but I mean, we have parts of this community where 94% of the people are white. In Flamborough, only 6% of people in Flamborough are visible minorities. Only 7% of people in Dundas are visible minorities. I'm not picking on Flamborough or Dundas, but I'm just saying that you have very, very homogenous communities there, and one wonders whether or not that just perpetuates the homogeneity of those communities. Meanwhile, you've got places in Hamilton, like the Mountain, where it's 1 in 4 people are visible minorities. And then you drill down a little further to things like refugees. Well, as I said in the Census Project, and this one just stunned me, if you just look at one little tiny neighborhood opposite Eastgate Square on the other side of Centennial Parkway, something like more than 1,000 of the 6,500 people that live there are refugees, okay? So more than 1,000 out of 6,500. If you take all of Dundas and Flamborough, add them together, there's 65,000 people there and only 490 refugees. So less than half the number of refugees in all of Dundas and Flamborough than this one little tiny neighborhood of a few blocks. And that, to me, just points to the fact that we just have this really economically segregated and racially segregated community, and I don't think that's healthy for anyone.